Hello guys, welcome to my channel where we make videos that cover all you need to know about medical doctors and medical students. In today's video, we're going to talk about 7 reasons why doctors are being hated. And yes, some of these reasons are being caused by us, whereas some of these reasons are not actually our faults. And in this video, you'll be able to understand this, and I hope this will help repair some of the fractured relationships we have with the general public. Reason number 7 really has nothing to do with anybody per se, and it's a reality that we have to accept. If you're new to this channel, please do well by subscribing and turn on the bell notification so you don't miss my new videos, which I drop twice weekly. That's every Tuesday and every Saturday. And to my returning subscribers, thank you for coming once again to view this video. So let's dive into today's video. In 1966, a research was being done in America in which 75% of Americans responded to be very confident in medical doctors. However, this research was being repeated in 2012, and the number of people to respond in the same manner were found to be just about 34%. The same study was being done in 2019, and this time around the number was down to 15%. We wonder what will happen in the next 10 years. And this phenomenon is not just peculiar to the US, it's a global phenomenon, although the measure of hatred is relative to different countries. But then we know that we are increasingly unpopular amongst a lot of people. Actually, we're doing better compared to lawyers and the police force, but then the nurses are being regarded better than us. The first reason why doctors are being hated is because most of our patients meet us at a point of vulnerability and weakness. Research has shown that anger or resentment is usually a secondary reaction. It occurs as a result of something, and there's nothing that causes vulnerability as much as ill health. Being vulnerable could make people respond in anger just to defend themselves or to bring themselves back to a place of control. And it's even worse when the doctor does not seem to assure the patient that he or she is in safe hands at that point in time. We know that a lot of doctors are going through a lot and might be insensitive to that, and that has contributed to the bad perception people have for us. We need to be way more deliberate in how we handle these people, because we are, to some certain extent, are responsible for the backlash that we're facing. Nobody loves being vulnerable. However, it's also been established that being vulnerable, in as much as it makes you feel weak and powerless, could also help you to grow stronger, and could also help you to build a stronger and more intimate relationship if you're able to handle it well. So I hope that we'll come to an understanding, both as doctors and as patients, when we work together to be able to help each other improve. So doctors, please play a role towards ensuring your patients are at ease, knowing that you really care about them, because you do, instead of the other way around where you seem like a very arrogant person that just wants to show he or she knows too much. The second reason why doctors are being hated is the almighty internet. Yes, the internet has made it easy for people to have access to a lot of medical materials, and this has increased knowledge to a certain extent that some even feel they are equal to or more knowledgeable than medical doctors concerning health conditions. Okay, don't get me wrong, we do not in any way wish to undermine your knowledge, but just know that medical training still remains one of the most rigorous and deliberate training ever in the educational system. Medicine is both a science and an art. A doctor is being grilled to have the degree of knowledge that he or she has. So don't just think that having access to internet materials just makes you an authority in terms of that knowledge, way more than trained health workers. Yes, some doctors might be very uncomfortable with that, but many knowledgeable doctors will even love to listen to your idea or what you think about it. In as much as we encourage you to research, there's one popular saying: never Google your symptoms, or else you see yourself as a dead man walking. We know how to sift through signs and symptoms and many other things to be able to arrive at diagnosis in a better way. So please, if in any way you feel that we are not knowledgeable enough, engage us respectfully. And if you see us as being arrogant or unwelcoming, let us know too. You know that part of your right is refusing a particular doctor to treat you, or a particular health worker to treat you. So there's nothing wrong with that. You don't need to fight with somebody. But know that most doctors, an average doctor, knows a lot, way more than you think he or she does. If we are able to have mutual respect for each other and see doctors as authorities, which they really are deservedly in terms of health matters, it will go a long way in helping us. An average doctor really knows, and an average doctor really can do a lot within his or her power. So in as much as some of these sites might offer you faster understanding per se, but then when it comes to health conditions, it's not really as straightforward as you think it is. The third reason doctors are being hated is as a result of the media representation of doctors. Gone are the days where media representation of doctors was more of respect and confidence. It has now grown to doctors being despised, and this is even increasing currently. Please understand something, that bad news sell, and usually the bad news that happen in the hospital or bad acts committed by doctors usually sell way more than the good acts. And these bad acts are not as much as the good that doctors do. Doctors save a lot of lives. A good doctor saves way more lives than he or she loses. And most of the lives that have been lost are not really out of incompetence. Yes, there are a few bad eggs amongst us, but let them not stain the reputation that we have. So the media usually use this to sell, and the more they are able to attract you so that you view more, and they're able to make their profits from it. But then if you go to an average hospital, these health workers are very dedicated to seeing that people are doing well, and they play their best and sacrifice a lot to ensure that these people are being treated and arrive at the best possible health outcome. Some media portrayal involve doctors as being overpaid, lazy, dumb, or very scandalous. Some of these movies or series we see about medical doctors do not really portray us in our struggles, and many of them even focus on the social life instead of the professional life. We can tell you how much they get these professional aspects very wrong. Don't allow the media to fool you to think that doctors are not as competent as they actually are. Another thing is social media too has also helped this to spread like wildfire. Many will just have a bad experience with a doctor also and then spread it out, and these are also being generalized. I remember we had an incident then back in Nigeria when somebody, a patient's relative, just spread on Facebook that our hospital and our department had maltreated their child. And when the doctor on call told us about that, we came and reviewed the patient. The patient was doing well, and we had to call the father to understand what had happened. It was in a moment of anger that he had done that. And unfortunately, if you had seen the comments on social media concerning that, the harm had already happened and could not be undone to a certain extent. The child was doing well. The father apologized to us. Unfortunately, we don't know if he took it to the social media to also apologize and correct that. So many people get very emotional and also post things on social media as a result of bad encounters with doctors, and this affects other hardworking doctors that really mean well. Understand that most doctors actually mean well for you, and I'm not just speaking for doctors, I'm also speaking for other health workers. They really mean well for you. They really care about you compared to those that don't. The next reason doctors are being hated is because doctors are being seen as exploiting patients, innocent patients, to enrich the hospital and other companies like insurance companies and pharmaceutical companies. So in this way, doctors are being seen as either over-diagnosing or over-managing patients so that they'll be able to take more money than expected and enrich the hospital. This is false. Yes, there are doctors that are this exploitative, but know that an average doctor's salary has little to do with the amount of patients the doctor sees or the health outcome of the patients that he or she sees. So we are not directly affected by these things as being seen or perceived by the general public. In fact, many doctors don't even know the cost of many of these diagnostic procedures, many of these drugs. We don't know, although it's advisable that you know, so that you'll be able to discuss with the patient and choose the most financially wise interventions for the patient too. In the course of trying to get well, we try as much as possible to prevent patients from being bankrupt. So no, most of us are not really rewarded handsomely by these companies. We are not even rewarded handsomely by the hospitals because we saw more patients. This perception is simply false. We don't act in that way. So an average doctor is not this exploitative. Let's drop this notion. The next reason doctors are being hated is as a result of frustration that comes when patients realize that management is not as straightforward as they had envisioned it to be. An average person believes that he or she walks into the hospital and the doctor arrives at a diagnosis as soon as possible and is able to prescribe medications for the patient, or in some cases perform some surgical procedures that will also fix him or her. Now, many times it might not be that way. Arriving at a diagnosis might be way more complicated, and it might be way longer or a bit more cumbersome than expected. And this does not in any way mean that the doctor is terrible or the hospital is terrible. Some cases are like that. Sometimes we might not actually know what is wrong with you, and that is quite difficult. A doctor doesn't know all things. So we would love that you bear with us in this kind of situation. And doctors, please don't assume that your patients understand this. Try and appropriately explain to them in this kind of situation why it is so and what they should do about it. Don't just tell them and allow them to fight this on their own. Many times we do this and just leave them to figure everything out. So in as much as it's frustrating for you, know that there is no doctor that is happy to leave you confused or leave you frustrated. There might be a few, but then most of us are not like that. The next reason is closely related to the previous reason, which is frustration that comes as a result of unexpected health outcomes. Many times a patient walks into the hospital thinking whatever is wrong with him or her might be a simple problem, and then find out that it's way more serious than it is. Sometimes you might even be diagnosed with a life-threatening condition. That is very depressing. It could make someone very miserable. And we're being trained to tell you things as they are, although we're also being trained to do that with as much empathy as we can. This has caused many patients to be frustrated with doctors. Some of these cases might even be justified because they had sought help initially and these diagnoses were being missed, and now they are being diagnosed at a point where little could be done about it. Please, we plead with you, and doctors, please try as much as possible to reassure these patients that you're with them all along the way. Yes, work can be so overwhelming. There is a global shortage of health workers, and because of that, we might not be available to you. We might just drop the news for you and move on to other patients, and this is quite frustrating. So we just hope that this shortage of health workers is being resolved as soon as possible, because many doctors are leaving the practice. Please bear with us in that. The last reason is something that I said is not personal. This is because people don't love as much as before. People are way more isolated and more self-absorbed than before. The public lifestyle is now gradually shifting towards a solitary lifestyle. And this can be largely tied to the increasing incidence of mental health disorders. People don't love as much as before, people don't trust as much as before. So it really has nothing to do with you as a health worker or what you do. This is the reality of things. I just hope that in the course of our duty, we are way more deliberate in handling patients. We treat them as human beings and not as cases. We are able to show more love, we're able to show more care. It can be frustrating, we have our own battles to fight too. But then in these few moments that you have with the patient, especially people that are already down with many health challenges, you'll be able to give them reasons to see love. It's easier for someone who has been shown love to love back. And you could be that beacon of hope for the patient. And that also comes to doctors too. Many doctors are also battling with these kind of things. And we just hope that we'll be able to reach out to each other and be able to help each other as much as we can. Now that's all for today's video. What do you think about the video? What did you like? What didn't you like? What were you just discovering? What did you think I left out? Let me know in the comment section below. Don't forget to like the video. Don't forget to share with as much people as you think will find it beneficial. If you're yet to subscribe, please subscribe and turn on the bell notification so you don't miss my new videos, which I drop twice weekly. Thank you and see you in the next video.